Welcome Mrs. Sabatino and Tora to Bowwell Veterinary Clinic. My name is Dr. Natalia and I'll be the one doing your consult today. How can I help you?
Basically, I brought my kitten Tora because I noticed that she has a little bit of bad smell. In her mouth actually, and this started to happen about 2-3 weeks ago. Yes.
Oh, okay. So starting to notice some bad breath. No worries. And 2-3 weeks ago, was it?
Yes, and prior to that, there was a couple of times that also she had a bit of bad breath, but it wasn't all the time. But now it's every day.
Okay, so now every day you're noticing that. No worries. We can definitely help with that today for Tora.
Thank you.
So just because it's your first time at the clinic, I'll just get a bit of background history on Tora. How long have you had her for?
We have her, let me think, about 7 months now.
7 months? Congratulations.
Thank you.
And for Tora, does she have any pre-existing medical conditions? Is she on any medications?
No, it's actually, she's a rescue kitten.
Yep.
So when we got her, they didn't say anything in particular about her.
Okay.
But and so far she's been pretty healthy.
Excellent.
And the only thing she had is she had surgery. She was dissected.
Yep. Perfect. So that's all good news. And is she up to date with her vaccinations?
Yes, definitely. Yeah.
Perfect. And has she had any parasite prevention recently? So that includes flea and tick preventions, worming tablets.
Yes. The other vet that we went to the clinic, because we moved houses actually, and that's why this is a new place we're going now.
Perfect.
And they did that for us.
Okay, so up to date for both of those. That's really good to hear. So more about her dental health. So what food does she usually have when you give her food in the mornings and afternoons?
I give a mixture. Sometimes she takes dry food and sometimes she gets wet food. And that's what
she eats 2-3 times a day or more?
Yeah, about 3 times. Yeah,
3 times a day.
Yes.
Perfect. So small meals 3 times a day, and wet and dry food together.
Yes.
Okay, all good. And is there anything you're currently doing for her dental health? It could be toothbrushing, giving her dental treats, anything.
Oh yes. Now that you mentioned, there are some greenies. They
Greenies?
give a little bag with some greenies that she quite enjoyed. We
She
give a couple
enjoys
of those. Yeah.
Excellent. So that's really good. Do you give a couple of those a day?
Yes, we give it sometimes every day or sometimes every other day, basically.
Okay.
Yeah.
Perfect. Now that's really good news. So what we'll do, I'll just written down all that information for you. I'm just going to take Tora now and start a physical exam on her. So I'm going to check her mouth, check the rest of her body, make sure she's healthy, and then try and find out why that bad breath is happening. So I'll just borrow Tora for a second.
Okay, thank you so much for doing that.
Thanks. Okay, so we just did that physical exam on Tora and we're able to find out that she has what we call gingivitis. So that's a longer name for what
Sounds
is basically
scary, actually.
No, so it actually 80% of cats and dogs over 3 years old have this. But what it means is that there is irritation, inflammation, and redness around the gums. So this can happen when you have a pet that is eating food regularly but isn't getting their teeth brushed or cleaned as regularly as they need it to. So you and I, we brush our teeth 2 times a day, but people often think that pets don't need toothbrushing because they can't do it themselves, but they actually need to maintain their dental health too. So gingivitis is completely reversible, so we can work together to actually reverse the irritation that's happening.
Well, thank you. I feel much better now. Thanks for explaining that.
That's great. So what we're going to be doing for Tora is I'll give you a couple of recommendations of things we can do to help out that gingivitis. So that can include things like toothbrushing. Would that be something you'd consider for Tora?
Yeah, I give it a go, but I'm a little bit scared because I'm old, so I'm not sure if she might want to bite me or something. Yeah. I'm not sure how to do it.
No, we can practice that today with you so we can make sure you feel comfortable.
Oh.
So toothbrushing can be really useful for our pets. It's ideally once a day, if not up to every 3 days, can still be really useful for them. You use a finger toothbrush and you basically brush them the same way you'd brush our teeth, but using the finger toothbrush to brush their teeth. And it's really important you use pet toothpaste for this. Reason being that human toothpaste can actually really affect their small tummies and it can give them vomiting or diarrhea. So you want to really use human toothpaste. So you really want to use pet toothpaste for this, not human toothpaste.
Oh,
So
thank you.
yeah, all good. So you can get both of those things here. I'll get one of the nurses to show you after we finish this consult how to do both of those things. But the other thing that we found when we were checking Tora over is that she actually has overcrowding in her mouth. What that means is that when she grew up, she transferred her teeth from baby teeth to adult teeth, just like we go when we're little from baby teeth to adult teeth. Except in her case, some of those baby teeth didn't fall out. So it means that in her case, she actually has all her baby canines as well as her adult canines, which are overcrowding her mouth. Makes it difficult to brush her teeth and get her teeth really clean because there's more teeth involved. That means there's more gaps for food to get stuck on. What we'd recommend is instead of leaving those teeth there, to actually do to remove those baby teeth, because at this age they won't really fall out on their own. So that would be a dental, but we can also clean her teeth in that process, get her teeth back to a really healthy state, and then continue with the really good toothbrushing and greenies that you're already doing. What do you think? Does that sound alright?
I feel a little bit overwhelmed with all that information.
Yeah.
But yes, if you recommend that, I trust you and I want the best for my kitten and for the future. So yes, definitely is something that I will consider. But I'm on a pension though. Is it expensive?
Okay, so for our dental programs, we have a couple different things available. We have afterpay programs where you can pay over 4 installments, and if you're on a pension, you also get a 10% discount. Does that sound like it would help for payment options?
Oh, definitely, yes. Discounts always come handy.
That's great. And what I'll also do, I know you mentioned you were a bit overwhelmed, I'll give you a brochure to go home with. It'll explain some information about a dental disease and what gingivitis means for your pet. And then it'll give you some of that information written down. So over the next few days, you can read it on your own, and then you can see what you want to do with the booking in that dental or not.
Yeah, thank you so much. That's at my own time because I'm a bit slow, and to listen and understand everything. Thank you so much for that.
No worries. So that's all for today, unless you have any other questions or anything else you were concerned about?
No, not really. It was mainly the bad breath that I was concerned about.
Perfect.
Yeah.
No worries. So I'll send you out to see Julie now. She's one of our vet nurses. She'll go through showing you how to use the finger toothbrush and the toothpaste, and she'll also book in that dental for you if you'd like to book it in today. If not, we'll give you a card and you can call us back later.
Okay, thank you so much. I might take like a day or two just to read about it, but definitely I will get it done. I want the best for my kitten. Thank you.
All good. There are the brochures, and we'll see you next time. Thank you.
Thank you so much, Natalia.
Thanks.
Bye-bye.
Bye.
See you next time.
See ya.